Hi, Country Changers. I hope you are amazing. We are joined today by two, I have a feeling, men who might be a little bit rascally, who might give us a few laughs, which might be nice. But we are joined by Dave O'Brien and Andrew Preston from Active Health Riverina. Thanks for joining us, guys.
Hi, Dean.
Thanks so much for having us.
Oh, you're acting all shy and calm now, but that's not the way it was before when we first got on the call. So hopefully you'll warm up. Guys, I just want to start with you, Dave. You both work at Active Health Riverina. Just tell me a little bit about the business.
Well, it's been established in about 2000, and we've sort of gone through a bit of a growth phase since then. I joined the business 2015, and we've got a bit of a good mix of people at the moment, and I think the growth of the practice towards 17 full-time equivalent clinicians, and I think there's about 30 in total team members now, has been really, it's been based on just getting a chance to work with good humans. So yeah, the growth has been into podiatry and exercise physiology and physio as a core business structure, but it's really been it's been an enjoyable time to grow and to be able to help more people in the community.
Yeah, and having that holistic allied health resource across the Riverina is definitely a theme. Like, we're seeing a lot more of these more holistic services opening up and being accessible to people across the Riverina, which is really great to see.
Yeah, no, I absolutely agree. And I think it's been a learning process for us, is that we, being in the country, there's the old thought process that you have to be a bit of a generalist and do a little bit of everything. But we've really, as we've grown, we've been able to sort of niche down a little bit and allow therapists to focus on quite a specific population or an injury type or an area of interest, and they're following their passions and they're more engaged, and the community are benefiting from that as well. So we're having people that would otherwise have to travel to a metro centre being able to access the same level of care in the country.
Yeah, we'll come back to that, the benefits of working in the Riverina shortly. But just, I want to introduce Andrew, or get you to introduce yourself a little bit more before we dive into that. Andrew, you returned to Wagga after escaping. Do you escape to the city? I feel like you are kind of go have the city experience. Tell me about your decision to leave and then return.
Yeah, I suppose my story is probably not that different to a lot of people's stories that grew up in the country. So I grew up in Wagga and left when I was 19 to study, firstly on the Gold Coast, and then spent the last 10 years in Sydney. So I was 17 years away in total. Reasons for leaving were, yeah, I just felt like I wanted to explore and see the world and experience different places and different cultures, and did get both of those ticked off in my times in Queensland and New South Wales. And ultimately the decision to move back, I was married and we recently had our first daughter, who was about a year old. We're living in Bondi. It's getting pretty cold, pretty small, and COVID occurred as well, and both of our support networks were back. So there was a very attractive reasons why Wagga was appealing to us, and yeah, keen to elaborate on those. But that's really the long story short version.
Now, both of you do have families, and you've touched on some of the incentives to come back to Wagga and the Riverina. But if you could both give me maybe your top 3 reasons or benefits of lifestyle and family that, I guess, really, when people ask you, why do you live where you live, that just immediately jump to mind.
I can start here, John. So I love golf, and when
not family first,
I was
no,
going
to
say, what does the wife?
You said outside family, so so golf in Sydney was inaccessible, and part of the I suppose the difficulty in Sydney was being able to access those hobbies and things and that you like to do for yourself. And so commuting 45 minutes each way from Bondi into the city, it was bus, train, and there was delays, and if it was raining, you were almost late for your first client. And so that really tied up a lot of time. And so since I've been back, I basically haven't missed a week of Wednesday lunchtime golf with 3 of my mates. So that's definitely been a huge thing. Commute time, as I said, it's now 6 minutes. It used to be anywhere from 40 to an hour, depending on what time. And I was often getting home at 8:30 at night time. And the latest I get home now is 6:45, and that's time to put my girls to bed. So that's really valuable time for me. I'll leave Dave with the third.
That's a cop out.
I suppose I think Andrew tells a story when he first moved back from Bondi that he was running a little bit late for work and got school traffic, had a train come through, a freight train that he had to stop for and wait for 4 or 5 minutes. And I think the total commute time was still 12 minutes.
12 minutes. So I text everyone in my WhatsApp group and said, mate, this 12 minutes is the best. And they said, geez, you're unlucky getting the train. That's a pretty long time to take to get to work from where you were. So, yeah.
Pretty short.
that was my first morning on the way to work. So, it just allows time to spend, valuable time with the people that you want to.
Yeah. And how? Oh, sorry.
You go.
I was just going to say, and how, like I think getting time back, we can all say, oh, that would be great. But what tangible changes that made in your life in terms of like the connection with your family, or, you know, I know you said getting to golf and stuff like that. Like, can you put that in real terms around the impact that has made on your lifestyle?
Oh, absolutely huge. I mean, ultimately, the why you go to work is for your loved ones at home, and being able to commit and be true to your word that you'll be home to put them to bed. That's going to create big changes in the way you interact with your family and your daughter and long term. So being able to have that concrete plan, being able to deliver on your promises, it's such a tangible change. I mean, even in the idea of being able to have time to exercise, so looking after yourself first, then allows you to obviously be able to spread that across your placement. So there's so many different aspects that getting that time back has resulted in, filling up my cups more often, and hopefully that spreads to a greater connection with my wife and family moving forward.
Yeah, beautiful. Thank you for sharing that. And Dave, how about you? What are your top 3, you know, big turnaround moments moving to the Riverina?
I suppose the biggest change I noticed was when we lived in London. We did the Australian thing for 2.5 years, and worked and travelled for 4 kids. And when we moved back here, we were thinking, well, this is our chance to pick the place that we want to settle, and why don't we go to the coast, or why don't we move to Queensland or do something crazy? And we moved back to Wagga and thought, oh, we'll save some money and then we'll go, and we just never really left, because everything's just amazingly accessible, and people are friendly. But time and space, I think, are the 2 main recurring themes. And I share your sentiments too, Andrew, that I'm able to go and pick up May from school, my oldest, and it takes 5 minutes to get there. You can get to a school assembly, you can go and see sport, you can exercise, you can do things for yourself, and you're not investing that time in travel. You're able to be there in 5 minutes, which is great.
I can imagine running a business and managing a team. Those kinds of value adds would make you an attractive employer. I know everyone else in the Riverina, I guess, has those benefits, but if you're talking about attracting people from the outside regions, because, you know, the Riverina, Murray, we need people. We need a lot more people in region with skills across a range of industries. What are some of the things that you're noticing are of huge benefit and of interest to people who are looking at moving or, you know, applying for jobs with you? What are people looking for?
I think flexibility is always the theme that comes up. So flexibility of work time and work location, I suppose, and that's something that we've embraced with COVID. Growth pathways, and I think people, when they're moving back to the region, don't want to necessarily see it as a step back in their career. They're thinking, oh, well, if I'm leaving the city, I don't want to be missing out on all of that effort that I put in moving up the ladder. I want to be able to still grow and progress, and that's definitely been a big focus of ours, is showing people that there is a pathway for growth and that it is supported and mentored. And and I think that's something that the regions are doing a lot better now, is being able to give people those opportunities and that access. Anything else you'd add in?
I have been lucky enough, shall we say, to be handed the opportunity to try and help out with recruitment from Dave and Paul since returning, and definitely flexibility is a big one. But to me, what Dave alluded to earlier in relation to being able to follow your area of passion is huge. And so people, for example, myself, I was 10 years of physio experience, and I was managing a practice in Sydney at the time, and I wanted to I really liked the business development side, and recruitment was a part of that, and managing a team and being a mentor also, and I've been able to slot into those roles, and they've basically carved them out as a result of me returning to the clinic. And so I found in other people that are looking for roles at Active, they definitely want to try and find something that they're interested in and passionate, and we're creating roles according to what their passions are, rather than trying to fill a void or a need that we may have for a certain clientele.
Yeah, that's a really...
I suppose.
Sorry, Dave.
I keep on. That's
all right. No, there's a little bit of a lag, so I apologise. You go.
It's something that we've sort of seen as a big opportunity, is that you can definitely pick the work and the impact that you want to make, rather than be competitive and have to find an area that someone else isn't servicing like you would in a metro area. So we can get people, and as Andrew was saying, we can fit their work week and their work interests to the person. So we really can recruit from a personality first perspective, rather than, oh, we've got a need and we need a person to come and fill that need. We do it the other way around, which is, I think it's refreshing to be able to do that. And then if the personality doesn't fit them, that's the thing that we recruit for first and foremost, is this person going to be fun to work with? Are they going to complement the group, or are they going to create friction? And that's something that we definitely don't need. So which is refreshing.
And in terms of the business ecosystem, not only in Wagga, but wider afield, even within your industry, what are you seeing? Are there any changes, trends, hopes around how you want to steer that?
I think the biggest change has been COVID has really reset people's expectations a little bit. And I think there's a lot of people that are unfortunately leaving the profession because of it being a service-based industry and having quite a challenging few years through the pandemic. It's taken a real toll. And I think that we sort of saw that the business side of things sort of fragmented about 5 to 6 years ago, when the NDIS really came into full force, that lots of smaller clinics set up with 1 or 2 people in each clinic. The number of private practices in the country more than doubled in that time. So there was a lot, not necessarily more therapists, but people moved away from teams into individual kind of working environments. And I think the pandemic's actually bringing people back into groups, because the social aspect is something that people found out that they were missing, and that being a single practitioner or a business owner by yourself is actually not an easy thing to do, particularly in troubling times. So I think that's something that we're seeing more and more, is that people are coming back into a group and coming back towards a team. Sure. Which is a big thing of why we wanted to be in a group, because we want to create that environment where everyone has an idea that gets thought of and can push something forward. So if it's a good idea, we implement it. It's as we try and embrace a non-hierarchy sort of approach.
And how would you describe the Riverina business community in general? Andrew, you might want to answer this one, or you can jump back on, Dave.
That's right, I know we're a big one.
So I find that it's the people in the country are down to earth, and you can spot them a mile away, and so the relationships that I've developed already have been fantastic, and probably would have taken triple the time in the city. So nurturing professional relationships from GPs and doctors and specialists.
Quite a few on the golf course.
Quite a few on the golf course, I must admit it.
For all the best done.
And I just find that the word of mouth referral, you can almost literally by having a chat to a couple of people, you can someone knows somebody that has done a fantastic job at home in a home improvement area, or has a fantastic referral for a doctor. It really feels more intimate and caring, the relationships I feel, and less transient than would be in Sydney.
Yeah, 100%. I was talking to someone about regional folk the other day that we're both from the country, and we were laughing because we were at a conference in the city, and we were responding to the fact that in the country, exactly like you just said, you build up really strong relationships pretty quickly, but country people have really good BS detectors. So it's like you
very
can
true.
cut through really quickly and establish that strong relationship because, you know, they're just real.
Yeah. And you can tell straight away the difference in, it was so clear within the first 3 to 6 months of being back, that genuine sort of personality trait.
Yeah, awesome.
And I think, and the opposite of that is, I think that if that's not something that follows through, if somebody isn't genuine, then the word spreads amazingly fast in an area like this. If people are not practicing ethically, or people don't like the experience that they've had, they're going to tell 20 people, and that is going to really have a compound effect quickly. So.
For sure. And in terms of the business community, as you said, there's lots of professional relationships that you've built up, creating those referral systems, et cetera, et cetera. And you touched on it earlier, those growth pathways. Is there anything that you want to share in terms of maybe your observations or experience around those kinds of mentorship, guidance, leadership opportunities that may have impressed you around that space, or events you are involved with, or like groups that support those areas?
I suppose we've been really fortunate. The local business chamber's pretty active in the community, and that's a good chance to stay connected with different businesses and different ideas and different mindsets. And we find that quite valuable. For more sort of specific health discussion, I suppose, that we all, us people in allied health, think pretty similarly, I suppose. There's a nationwide group that we're a part of that have lots of regional clinics, so that it's a private practice owners group. And we really have that abundance mentality where people share ideas and concepts that are working and bounce problems around the group and get lots of different opinions. So we really find being able to lean on each other in that regard's been really helpful, particularly over the last few years. So there's sort of local support, but then also a nationwide connection that does allow different regions for us to talk to each other and share ideas.
Yeah, and I can chime in here in relation to some of the attractive traits of when I was weighing up moving back to Wagga and Active, and Dave and Paul and the systems that they had in place. They were really quite dynamic, and I felt like they were at some times more progressive than they were in the city. They were adopting really current strategies for clinic owners, and I could tell that they were part of a mentoring program because I had sort of dabbled in it a little bit through managing the own practice. And so that was a really attractive part. It wasn't like it was a stagnant old school physio practice that's got the old townhouse down on the corner in the main street where there's someone putting ultrasounds or interferential. It was dynamic. There was good, strong leadership. They were implementing really good mentoring pathways and progressions, and really, as Dave was saying, it's very much a team first mentality. Desire statements and personality profiles before I'd even set foot in the place. So it was they were true to their word in relation to a lot of the practices that I had put in place.
Yeah, that's really cool. And I think one of the main misconceptions I hear from people who've not potentially worked or spent too much time in the country is that you don't have that quality of service or business or entrepreneurship. I think I said that wrong. But I can 100% attest to the fact that we have so many dynamic, professional, cutting edge, innovative businesses and leaders in the country, in the Riverina and Murray, that it is so impressive. And if you haven't experienced it, I would definitely be encouraging people to, dabble, pick up the phone, do your research, visit. Before we wrap up, gentlemen, were there any other words of advice that you'd like to leave on with our viewers who might be considering a country change, whether it be work or lifestyle, family related?
It's a good question. I suppose it's a fairly biased point of view, us knowing the benefits of being in the country. But we often find people that come from the city and are pleasantly surprised by all of the things that are happening, by the space, but by the people, by the events, by the opportunities. And I think people, particularly COVID's kind of encouraged people to start to look outside their own bubbles, which is a good thing. So being able to have an open mind and come and spend some time in a region and meet some people and see what you think.
Yeah, and I mean, I think a bit of advice would be for those people that might be thinking about what a potential next move might be, is sort of go back to the why aspect of why you're doing things and why you go to work, and is that to provide for your families, or is that to it's a huge different I suppose vast amount of reasons why people would go to work, but start at the why, and for me why was family, and by being able to move to the country, that's enabled me to really put family first, and with space, but more time, and also being around my parents as they grow older as well. So really going back to that core purpose as to why, I think have a bit of a reflection time on that, and yeah, look to the country if you feel like, you know what, I want to get some flexibility back in my life. I want some more time with my family or whatever that might be.
Yeah, and a beautiful point around the why. I think that will resonate with a lot of people, particularly post-COVID. So, gentlemen, thank you so much for your time and your insights and sharing so much about your experience and the business world of the Riverina. If anyone wants to check out, it's Active Health Riverina. You can Google them. I'm sure it's an easy find. I did it myself. Check out the website. Keep an eye out for jobs, by the sounds of it. If you have any questions, please reach out to our team. Head to countrychange.com.au. We'd be happy to provide you some guidance around what opportunities exist across the Murray Riverina. So, gentlemen, thank you again. Really appreciate your time.
Thank you.
Thanks so much.
See you guys.